Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program focuses on services, programs, and physicians that we have here in Kingman that will help give you information you need to make choices for you and your family. I've got a great guest on the show today, so I hope you'll stay tuned, and we'll be right back after these messages. Welcome back to Your Health Matters. My guest today is Melissa Sullivan, certified nurse practitioner. Hi, Melissa. Thanks for being on the show.
Sure. Thanks, Jamie.
So you're with Sunshine Canyon Healthcare, and there's three of you, right?
Right.
You've been together for a while now. How long have you been working together?
Oh, as long as I've been a nurse practitioner. So.
Oh, really? So it was like your
It's
first?
many years, yeah.
Oh, I didn't realize that.
Yeah. We started as Sunshine Canyon about 3 years ago now, in September. And we love working together. It's
That's
like a
great.
family.
You're a good team. Yeah, you are. Yeah. So how long have you actually been in Kingman?
I've been in Kingman about 11 years.
Oh my goodness. So you've seen some changes. The last 11 years have been kind of a big growth period.
Big growth
for
period.
Kingman. Now, were you a nurse first, or how did you become a nurse practitioner?
I started out wanting to be a doctor, actually, all my life. And I got into nursing because there is no pre-med major. You have to major in something. And actually fell in love with nursing. I became a nurse in 2006.
Okay.
No, 2001, sorry.
Okay.
Wrong. And came up to Kingman, loved Kingman, worked here, and then I had to go down to Tucson for a couple of years for my husband's schooling, and figured I would take advantage of the school down there and went for my master's while I was
very
there.
good. And so that's how you became a nurse practitioner. So for a nurse practitioner, you start as a nurse, you're an RN, is that right?
Right.
And then you get a master's and you can become a certified nurse practitioner.
Right. And actually now you have to have a doctorate as of next year.
Oh, wow.
But I have a master's at this point.
Very good, okay. So now you said your husband, what does he do?
My husband does everything.
Oh.
He's also working on getting into the medical field right now. So
very good, very good. So you've been in Kingman about 11 years, and where were you before that?
Tucson. I'm a Tucson native.
Oh, you are? So you're Arizonan.
Arizona
you know
native.
the weather.
Yes, I have to be in the heat.
Right.
And the dryness.
Yep. It's a big difference if you come from the Midwest or something like that, but it's still good. My grandkids were just here, and we were talking about the difference between Minnesota heat and Arizona heat, and not having that humidity to mess with. It's just like, ugh, don't miss that at all.
Not at all.
So it's you and Autumn and Lisa.
Right.
Now, did you know each other before you moved to Kingman? How did you get together?
No, I met Autumn at KRMC on the floor as a nurse. That's actually working nights way in the late hours, 3 a.m. when everything was quiet. We developed the vision of having a family practice clinic.
Awesome.
And Autumn and I started going to school and got our degrees. And I met Lisa as one of my preceptors as I was finishing out school. So I worked under her until I finished, and then got a job where she was working at that time. And then Autumn came in and precepted under both of us and joined the team, and that's where we started.
Very good. So your family practice, I mean, you can see the whole family, all ages.
All ages.
But is there any that you specialize in, or you have a preference for?
Being moms and having kids, we tend to enjoy taking care of women and children. We love everybody. We love our men and our babies and our elderly and everybody. But we definitely, you know, what you do makes it easier to understand and
coming from that personal experience. So it's Autumn Bowles.
Autumn Bowles.
And Lisa Workman, and then Melissa Sullivan. So I'm just making sure everybody knows your full name, so if they want to look you up in Sunshine Canyon, I always refer people to the hospital website, because what's fun about that, they can go to KRMC.com and under physician directory and look you guys up by your name or by specialty, and then it brings up your page, and it has their picture, and it gives their contact information and your education. So let's talk a little bit about nurse practitioners and the difference between, say, a nurse practitioner and a physician.
Okay. In Arizona, nurse practitioners can practice independently. like a family physician. We're able to prescribe the same way and diagnose the same way. The difference is a little bit of the philosophy and the training background. We come from a nursing background. We have nursing experience, and nursing is a holistic philosophy, looking at the whole person and how everything in their life kind of affects their health.
Yeah.
So it's it's a little bit different than the physician. It's a good collaboration. There's we work well with the physicians and vice versa.
That's great. So pretty much a person can come to see you for any health issues they're having, and then you can refer if they require a specialist.
Right.
But you can write prescriptions for their medications and that type of thing.
Right.
Then what happens if they do need to go to the hospital?
If they need to go to the hospital, we're able to work with physicians there or direct admit them to the hospitalist. We have a great team of hospitalists who work solely in the hospital with the acute care. They coordinate with us and have records and conversations with us when needed, and then once our patients are ready to go home, they also communicate with us what they've done and allow us to pick up where they've left off.
Awesome.
To continue that care.
Sure, so you've got the before and after, and the hospitalists just do that little middle piece.
Right.
While they're here. Very good, that's great to know. And I know personally, I think that sometimes it's easier, especially for women, I think, to talk to women. And I don't mean that to be totally sexist, but I think it's true that sometimes it's easier. And like you were saying, because you guys are all moms and have had child care experiences, so you can relate pretty well with other women. So that makes it easier. And I don't know, I just think nurses listen better. Sorry, docs, but I think that's true. You guys listen better. Has been my experience too. So when someone comes in and they need to kind of share the whole thing that's going on with them.
It's something we definitely try and focus on doing, is allowing people to really express themselves and also participate in developing a plan of care. So we're not just deciding what they need to do and telling them and sending them out the door. We try and work on a
Band-Aid kind of thing. You're looking to see what's
We try and figure out, even if it's maybe not what we would prefer to do with them, what's going to work in their real life situation the best for them.
Well, that makes sense too, because it's real easy to sit in an office and say, well, you should be doing this, this, and this, but then to take it home and put it into reality, especially when you got little ones at home and stuff like that, that's a challenge.
It is.
So now you said you have kids. How many do you have?
I have many kids. I have 3 kids right now. I have a 6-year-old and a 3-year-old. We also do foster care, so we have kids in and out. We have a little girl that just turned 1 that we had since she was born, and she did go home, but she's still in our hearts.
Of course. Girl, so. That takes a special person to be able to do that. Thank you. Because I know that the foster care program right now is really, it's hurting right now too, and they need more.
They need a lot more people.
And for the older kids too. I was just speaking the other day with Melissa Beauchamp, not to sidetrack too much, but they've started the Harbor House, which is like a shelter for runaways and homeless children, boys, and talking about how, trying to get these kids into some kind of a family environment, whether it's back with their own homes or into a foster, and there just aren't enough foster parents.
Huge need for teenagers.
Yeah, that's hard. I mean, I just had my 2 teenage grandkids for 2 months, so it's a challenge. But at the same time, it's very rewarding.
Very rewarding. Yeah.
So how long have you been doing foster care?
About 2 or 3 years.
Okay. Yeah. So that's very special. Again, I appreciate the fact you're able to do that. That's pretty cool. So I know in the paper, I'm going to kind of segue again here. We jump around a lot on this show, but not too long ago, they had an article in there about whooping cough and how it's coming back up. And I think there's obviously still concerns out there about immunizations.
Right.
And you guys do immunizations. You work with all the ages, right? So what are your feelings about immunizations?
There's a lot of negative media. Most of it is not scientifically based. It's people's opinions or speculations, and it spreads like wildfire.
Yeah.
Scientifically, with the controlled studies, the risk of having a vaccination is so much smaller than the risk of having one of these diseases that most people have forgotten are very crippling or fatal.
Right. We haven't had an epidemic of like whooping
Polio
cough or
or
polio.
measles.
Yeah,
or,
because of the immunizations.
Right.
But if
and now we're
people
starting to
continue-
see them come back around as people are not getting immunized as much.
Uh-huh.
And those diseases are coming back, and
Wow.
they're very serious.
And yeah, the side effects, and especially if they didn't get immunized and then they get older. Because I remember, I mean, when I was a kid, and even when my boys were kids, because they're in their 40s now, they didn't have the measles and mumps like they do now, the immunizations for them, and so they had to get them. And if you did not get it, then you got really sick with it when you're older as an adult. That's lots of other worse side effects too.
Right.
So, and I guess from a personal standpoint, I guess if you're saying you've had your children immunized?
Oh, absolutely.
Yeah.
Absolutely.
So,
you know, what people don't understand about vaccines a lot of times is that it's not really a medicine or something foreign. You're taking that same germ that causes measles or polio, and they either kill it or partially kill it, and your body is able to develop antibodies. It's like being able to capture the enemy when it's no longer a threat and study their weapons and figure out how to fight back against it.
That's what your body's doing.
You develop that defense just like you would if you got that disease, but you don't have to get sick with it. So you don't have that risk and that suffering through it.
Yeah, because I know, well, like measles, I remember when I was a child, I had measles really bad, and I was young. I was like 8 or 9, I think, but it affected my eyesight. I had lots of other, because of the high temperature and stuff, so you wouldn't want your children to have to go through that if they don't have to.
No.
That's what's
and really,
amazing.
for the majority of vaccines, the big risk is you might have a little fever, feel a little under the weather for a couple of days, and anytime you do an injection, you have that risk of infection at the injection site, soreness, pain.
That's minimal.
Pretty much the majority of it, unless there's an allergy issue.
Right, but that's pretty minimal too.
That's very minimal.
Compared to the other side of it. How much, and like you talked about too, if fewer people are getting them and then someone does get sick, and then it spreads. It can become an epidemic through our whole community. So it's very important that they get their shots for all those issues. And of course, whooping cough. I mean, I think I recall as a child too that was still out there. And I had a friend that just had this horrible cough. It just sounded like they were, their whole insides are coming out. That sounds gross, but
that's it is, and it's kind of what it feels like, I think.
Yeah, it wouldn't surprise me because it definitely. I remember them just being miserable and sounding horrible and very sick.
The nice thing about the whooping cough is that it's actually been added to the tetanus booster that we're supposed to get every 10 years, and as adults we forget to do.
Oh, yeah.
But every 10 years getting that booster and then having that whooping cough booster in there as well.
Very good. Well, we're going to take a quick break and then we'll come back, and I'm sure we have a few other things, so stick around. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Melissa Sullivan, nurse practitioner with Sunshine Canyon Healthcare. Thanks again for being on the show, Melissa.
Thank you.
It's always good to learn. I always tell people every time I do this show, I learn something myself, so hopefully our audience does as well. What other kind of healthcare issues? Now we've talked about, the immunizations, importance of that, but the other healthcare issues that maybe you see in the office.
We see everything from, sick visits to diabetes, high blood pressure, general issues in health. We have a real focus on trying to prevent health issues if we can.
Sure.
That's
Catch
always
them
better
early.
and cheaper
Yes,
for
right.
everybody.
Yeah, absolutely.
Seeing kids for their annual well child visits. I know school's coming up soon.
Right.
And sometimes it's very difficult to get into the pediatrician. We have wonderful pediatricians here. But they're very busy, and a common misconception is that you have to see a pediatrician for your child's annual visit or checkups. And family practice is very capable of doing that. We love seeing kids.
Good.
We try and our clinic is actually a little bit unique, that we try to really make things fun and interesting for kids. We have murals in each room. They're a little different.
I was just going to mention that. That's beautiful.
We love the murals. They're wonderful. That are interesting for adults as well, but try and capture the kids' attention. We usually have some little toys or something in the rooms as well as in the playroom to keep their attention and hopefully keep them occupied while they're waiting. we do try and offer, you know, toys or surprises for the kids afterwards to make it a little bit more of a positive experience after we've poked them.
Yeah. Well, and I know you have a separate entrance, right? You have two entrances.
We do. We have two entrances. We have a sick entrance and a well entrance. The sick entrance is kind of partitioned off, hopefully that, you know, someone who's coughing or very sick can stay a little bit separated from those who are well. So we're trying to not make our well people sick as well.
Right. Well, that's got to be kind of relieving for parents who, like I said, they're bringing their child in for just a yearly physical or to get new immunizations, whatever, and they really don't want them to be exposed to sick people. So that's a good thing. And it is, I know we've, like you mentioned, that we've got schools just around the corner, so if they need their sports physicals, they can get that done as well as their yearly checkups, so that's good.
Absolutely.
And their preschool, of course, and because I think parents need to, again, going back to the immunizations, they have to have that immunization record to get in school. So you can take care of all of that there.
We can.
Okay, and I'm going to remind people again that they can go to our website, azkrmc.com, and look up yourself. So it's Melissa Sullivan, Autumn Bowles, and Lisa Workman. I always want to make sure I got the names right. And again, they can go to the website and see your pictures and get your contact information, learn more about you. So it's a great team that you guys have put together. I'm proud of that you're part of the KRMC team.
Oh, thank you. I like our team too because we have very different personalities as well. Because one personality is not going to fit everybody.
Sure.
So, you know, we can cover for each other, but people are able to kind of find a personality that fits them pretty well. Usually.
So when they call to make an appointment, they can specifically ask for one of you.
Correct.
So they could ask to see Lisa or to see Melissa or to see Autumn.
Or if they are just dying to get fixed and don't really care, they can say that too.
Yeah, just who's ever open, get me in,
right,
kind of thing. And that's one of the things we talked about too, like fast tracks, obviously, you know, that's part of KRMC too, and that is a good alternative to the ER for the most. But the nice thing about coming to Sunshine Canyon too, not only usually you can see them pretty quickly, but they have that opportunity to build a relationship with their healthcare provider.
Right.
And there's a comfort zone that comes with that.
There is. And there's a nice follow-up too.
Good. So. Yeah, and that's important. And I think, like we were talking about earlier, the fact that all three of you are mothers and, you know, have gone through all those experiences. So it's easier for people to talk to you and understand. So when you're not doing healthcare or being a foster mom, what else do you do? Fun things.
Fun things would be I'm a Zumba instructor. I love doing Zumba. I do it at the Wellness Center right now, usually more as a participant or a backup. I'm a sub. You know, scheduling doesn't allow me to get into that as much as I can, you know, as much as I would like sometimes. I did recently get my Zumba-tomic license, which is Zumba for kids.
Oh, fine.
And so maybe as school starts, we'll be looking at starting something with that.
Oh, that'll be fun.
Yeah,
I've seen a few
kids. To get kids active.
Oh, absolutely. When we talk about obesity is one of course, a rising epidemic, speaking of epidemics, and getting them moving is really important.
Away from the iPhones and the...
Yes, some muscles besides the thumbs, right? Besides their video games and their phones, it's crazy. We were had a family get together one night. My oldest granddaughter was like, "We should have it where we tell nobody can bring electronics," because all the other kids were doing their phones or their PlayStations, whatever. And she's like, "We're not even talking; everybody's playing."
It's true.
Yep. So and Zumba is fun. I know I do the Zumba Gold on Thursday nights.
Oh, good.
Yeah, so it's, you know, for us that with the sore knees and a little lower impact, but
which I might be joining for a while now that I've got a stress fracture.
Oh, so how'd you do that?
Too much
Zumba?
Well, Zumba, Insanity, all the.
Oh, you do all that crazy stuff.
Well, I was trying anyway.
Your body kind of went, oh, let's slow down a little.
Yes, learning to listen to our bodies. Nurses are bad patients sometimes.
I know it. Well, Patty Stanton, who's also a nurse practitioner and my healthcare provider, and she and I were talking one day, and I can't remember what it was that I'd forgotten to tell her. And she said, "You know, my dad told me when I first went into nursing that patients lie to you."
That's true.
He said, well, not on purpose, but you just always forget to tell us things.
Right.
Oh, by the way,
Right.
you know.
Or trying to present what you would like to be doing rather than
Right, what the reality is sometimes can be entirely different. That's what I plan on doing. Someday I'm going to do that.
That's true.
So Zumba, you're teaching the classes, and now you're older. How old did you say your kids were? 6?
6 and 3.
3. So they're still a little young for Zumba yet.
Oh, they like it.
Do
They like it. And they're old
watching
enough for
Mom?
Zumba-tomics, so that's why I did
Oh.
it. Actually just got that licensing 2 weeks ago. So
Very good. Well, so
It's-
what age does it start?
ages 4 to 7 is Little Stars, and then from 8 to 12 is Big Stars.
Oh, what
So,
fun. That is good. You start them
Yeah.
early and get them going.
Absolutely.
So that's something you're going to try to get started here at the Wellness Center, or maybe do it at
Possibly
Sunshine
Wellness
Canyon?
Center, or at the school somewhere. We'll see.
Yeah,
We'll
very
see.
good. That'll be
And what's
fun.
nice about it is it's not only physical activity, but it actually has a lot to do with coordination
Sure.
and rhythm and a lot of cognitive function.
Yeah,
So-
yeah, I'm still working on that, you know. Go left and then go right. Yeah, I tell you, there was a reason my mom didn't name me Grace, because it does not come naturally to me. I have to really work at that. So maybe if I'd have taken Zumba when I was younger, it would have been better. I might have learned.
Probably.
Very good. And anything else? I mean, as a family, what do you and your husband like to do? You have spare time.
We don't.
Yeah.
No,
Too much.
we all like to work out at the Wellness Center and try to stay active
healthy.
together. We're trying to get outside now that, you know, the 3-year-old is old enough to walk on his own, not have to be carried.
Right.
We want to get back out into hiking and stuff
Oh,
if
good.
we can.
We have lots of good places
As
for
long as we
that.
have lots of sunscreen because I burn like a lobster.
Oh, yes. Well, and this time of year, so once it cools off, too, it makes it a little better. You can get up in the early morning or later in the afternoon when it's a little cooler.
Right.
And get out and do some hiking. That's good. You know, we went up to the Wallapies while the kids were here and had fun with hiking and seeing the moose and the elk and the deer. They kind of look like moose.
They do.
So very good. Is there anything else that you think that we want to make sure that our audience
You know, I'd like
knows?
to bring up Sarah's House. I'm a sexual assault nurse examiner at Sarah's House
about
too.
that. Thank you
Which
for
is
reminding me.
a great community service. We're actually really blessed to have that here.
Yes,
You know,
absolutely.
right now, everybody from Bullhead and you know, a lot of the Mojave County areas, the outside areas, have to come into Kingman.
Because we're the only one
We're
that
the only
have
ones.
that. Wow.
And it really is a really wonderful service. The girls there are very, very welcoming, very professional. You know, we have a great cooperation with the police department and the sheriff's office.
I think there's misconception too in the community about Sarah's House. A lot of times people seem to think it's maybe a shelter, and it's not.
Right.
Right. So
And
let's
I thought
talk
it was
about that.
too before.
Right. Oh yeah. So let's
Yeah.
talk about that. We've got time. Let's just touch on that a minute.
Sarah's House, if there's a sexual assault in the community, whether it's a child or an adult, male or female, Sarah's House is usually contacted by the police department or the legal place that's been reported to. And what we do is we bring the victim in, and we talk to them, and we do a forensic exam to collect any kind of evidence and documentation that we might need to try and find a perpetrator or prosecute the case.
Okay.
And then Sarah's House sets them up, the victims up, with contact information for like emotional support, counseling,
Great.
you know, follow up in the community for their health and the issues that they may have there. Definitely, it's not an overnight place. It's just a in and out.
Right,
Yes.
right. But it's so much better, I think, too, than the ER, you know, because going there versus...
And actually, the ER is not the place to go because they
No.
don't have the equipment or the training or the kits from the state to collect that forensic evidence. So the ER is just going to contact the Sarah's House and send them
there.
over there.
Okay.
And it is a 24/7.
If they
facility.
need more information, they can go to the website again and call you, and you can share them if people want to be involved. And we're running out of time, so we can't do much more. But you're a good contact source for them.
Yes. We need lots of volunteers for people who want to volunteer.
Great. Well, thank you, Melissa, for being on the show today. I really
Thank you.
appreciate that. I hope you all learned something today, and call Melissa if you'd like more information about anything we talked about. Thanks.